This video I'm going to be talking about administering oral care to an unconscious patient and cleaning dentures properly. So first, what you want to do is practice proper hand hygiene and then enter into your patient's room and close the door or close the curtain for privacy. Then what you want to do is, even if your patient is unconscious, you want to introduce yourself, make sure they know who you are, because sometimes they do know what's going on in their surroundings. So you want to check their chart and their wristband to make sure it's the right patient. Just make sure you're in the right room. Then what you want to do is turn your patient to the side of their bed and put down your rail, the side rail, and then you want to put maybe a towel under the patient's face, like right here, and then put a towel over their shoulders and over their neck, making sure that the water doesn't get on them when you're washing or brushing their teeth. Then what you want to do is you want to get a suction ready. So if you want to suction any of the saliva out of their mouth or the water. And then you want to clean their teeth properly and thoroughly. What you want to do is take the toothbrush at a 45-degree angle in their mouth and just clean through properly. And then what you want to do is suction any liquids out of their mouth and then rinse properly. Then what you want to do is, after that, take a lip balm or chapstick or whatever the hospital that you work in has, and you want to put that on their lips just to ensure moisture of their lips. And then you want to clean your hands, remove your gloves, obviously, then clean your hands and store all the products and the supplies that you used. So for denture care, what you want to do is the same thing. You want to enter the room, proper hand hygiene, put on gloves, enter the room, close the door or the curtain, and to ensure privacy, and then introduce yourself to your patient. Make sure it's the right patient. Ask them their name, their first and last, their birthday, on their wristband, depending on the policies of your workplace. Then you want to remove the dentures out of your patient's mouth if they don't want to themselves or if they can't. And then you want to ensure cleaning them. So what you want to do is you want to take a towel and put it at the bottom of the sink, and then you place the product on the toothbrush, whatever the patient prefers. You want to ask them, make sure. And then you take the dentures at a 45-degree angle. So say my finger is the gums and there's teeth coming out of the gums. You want to take your toothbrush at a 45-degree angle and brush, making sure that you get where the gums and the teeth hit of the dentures. And then you want to do that on the bottom and on the inside of the dentures, both the top and the bottom, depending on what the patient has. And then you want to rinse it thoroughly and put it back in the basin, the little container that the patient holds their dentures in. When you take them out, you also want to put them in the little basin and take it to the sink and clean them and then put it back in. Depending on what your patient wants, you can leave it in the basin and put it next to the bed, or you can put them back in their mouth. And then you want to take off your gloves, proper hand hygiene obviously, and then clean up the supplies that you used.